Okay. Okay. Oops. Right. Okay. Okay. So, okay, there we go. Erin just got us all set up. So, thank you all very much for coming. This is the last of the spring's Grant 101 workshops. It's the same thing as if you come to other ones, that just remember that we don't have any cues or feedback from you. So if you have questions or you want to sort of jump in, please do so. I would encourage it. Otherwise, we're just going to go through our presentations. So I'm going to start with an overview of how to think about getting non-NIH funding for your research. And then Dr. Claudine Jurkovitz is going to talk very specifically about PCORI and the opportunities for funding through PCORI, particularly since so many of the people in the network are interested in patient-centered research. So the thing that I really want to emphasize is that there are many other places that you can get funding outside of the NIH. And these are not just private foundations or corporations. There's a number of other U.S. government entities where there's research funding. And it's really important to use comprehensive search engines to look for these, because very often there are pockets of scientific research funding in locations where you would never expect. And one example that I think tends to get under applied to, especially from Delaware investigators, is the Department of Defense. The Department of Defense actually maintains a very large portfolio of biomedical research grants. Some of these are directly related to the DoD mission. One that is pertinent to my research is they have a program for looking at treatment of ocular blast injuries and long-term low vision rehabilitation. However, many of the Department of Defense biomedical research grants are not just in those areas. One reason is that you have to remember that the Department of Defense also runs the Department of Veterans Affairs, and they provide health care from childbirth all the way through senescence, because they do provide health care for military dependents and aging veterans. So they definitely have interest in those areas. I believe they also have some funding opportunities for things such as electronic patient records and things like that. But for many of you, another place to really be looking is at the congressionally mandated research programs. And this is the website for these. That a lot of people don't realize that the Department of Defense has been given the job of basically mentoring or administering a large amount of biomedical research funding. Now, where this came from is that during the 1990s, there was a patient advocacy groundswell. Basically, patients were feeling that the NIH wasn't directly addressing their health needs. And there were, and this was very, very apparent in breast cancer research, but there's a number of other areas too that they felt the NIH just wasn't responding to their needs. And Congress set aside a large amount of money, but based on the really for more clinically focused research, but this was removed from the NIH system because that the patient advocates didn't believe NIH would address their needs. So that set up the congressionally mandated research programs. And there are programs in breast cancer, prostate cancer. I just looked, there's a new program in tick-borne diseases. There's a whole host of things there that, and those grants, they are reviewed very differently than NIH grants. And one of them is because of how they were formed, almost all of these panels have one or more community members as representatives. And community members can have a very, very different perspective over what is important to fund in a grant mechanism. I know I have friends who've served on these DoD panels, and they say that it takes the review in a completely another place. So if you do decide to go for these congressionally mandated research programs, it's really important to look at the databases to see who's funded and see if you can get people's grants so you can understand how The science side is addressed, as well as convincing the patient advocates that this research is actually going to maybe move in a very translationally important research manner. All of these NIH, all of these government funding mechanisms, though, are available to you in one place. That's grants.gov, and there are comprehensive search engines. These also have a lot of information about certain community-centered research programs that are outside of DoD or NIH or CORI or other systems. For instance, there are grants about researching things like foster care and things like that that are available through grants.gov that are, again, outside of what one would consider the place to normally look for them. Okay, so the thing that I want to talk about is a little bit of advice from non-NIH sources. One is that, as always, follow the directions in the packet, make the deadlines, etc. You have to remember that foundations have a very, very different mindset than the NIH granting people. And when they say they want lay abstracts, the lay abstract for an NIH grant is there to make Congress happy. The lay abstract or the lay descriptions in a foundation grant can be critical to your getting your grant funded, because very often those foundations are run by people with that disease. If they're not convinced that that research is going to help people with the disease, they're not going to fund it. Similarly, even foundations where the review is very, very scientifically based, they still have to sell with their funding to their donors. And it's a very, very important give and take. These foundations have very enthusiastic donor pools. They'll organize gala banquets. They'll organize dance marathons. They'll organize all sorts of things for fundraising. And they have to be able to market your science back to their donors. So being very good at communicating to a non-technical audience can be critical getting funded from a foundation source. This is also part of, if possible, contact somebody with a funded grant from that organization and try to get a copy of it. This is, again, very different grant makers expect very different emphasis. For instance, a lot of scientists get very blindsided when they go to apply for their first National Science Foundation grant. The National Science Foundation, they make grants for basic science, and they do have a very, very rigorous scientific review process. However, all NSF grants have a broader impacts criteria, whether they're a fellowship or a full grant. And those broader impacts criteria are given equal weight to the science in the grant. Now, broader impacts can be a number of things. They could be bringing your science to the community. We have NSF-funded investigators in my department who are doing things like going to the Delaware Science Museum and setting up exhibits on developmental biology questions. We have people who have made mobile science labs, which they take to 4-H, they take to schools, they take to science fairs. That basically NSF really wants to make sure that you're not just doing great science, you're also very, very strongly connecting your science with the community in a larger way. And the first reaction when people see those broader impacts criteria, they think, oh, they can't really mean this. As somebody who served on NSF study sections, even for things like small business grants, they expect the small businesses to be engaging with the community if you get an NSF small business grant. If you're applying for an NSF-based fellowship, the people who get these grants are not just the best students who have the best research proposal. They're the ones who have volunteered in the community, who are tutoring in the schools. It's very, very important. Similarly, as I already mentioned, DoD grants also have they can have a very patient-centered focus. So you do have to address that patient-centered communication. So is there any questions about really understanding what when you're going to these grant mechanisms, understanding where you need to put your emphasis? Okay. Another thing that I really can't emphasize enough is, again, to make personal contact with the organization. That this is really important because very often it's very difficult to understand the scope of their grant making. There are several foundations that I'm aware of that their actual grant announcement makes it sound like they're open to funding anyone who's working in a particular area. However, when you actually talk to the people, they give 95% of their money, let's say, to scientists based in Ohio. And you're not going to want to spend the time, effort, and significant energy to apply to those grant mechanisms if they're very, very geographically focused in their grant. Another issue that, especially in our environment, that you're going to need to think about is most of these foundation grants tend to be given to young investigators. However, you should, as you consider putting your effort into applying to small foundation grants, keep in mind they can often be as much or more effort to apply to as funding mechanisms with an awful lot more money. This is also that foundation funding seldom or even never generates indirect costs for the institute. And this is very understandable from the foundation side. These are people who are scraping and putting together bake sales for $300 in grant funding, which to us is a tube of antibody. It's nothing. But to them, it was their work for the weekend to put together a bake sale. So they want to see their money directly funding research. They don't generate indirect costs. However, research that's done in an institution that isn't generating indirect costs actually can, from the administrative perspective, can cost the organization more money than it generates. That said, almost always your supervisors and grant administrators want you to go after these money because this is the seed money that you need to try to get grants or government contracts that will generate indirect costs. That said, you do have to be aware of this issue. I was actually at my first meeting at the University of Delaware where this issue of what percentage of grants are generating indirect costs in individual departments was actually discussed. I'm less familiar with the culture at Nemours or MUSC or Christiana in this issue, but it can come up. That said, I would encourage you to go for foundation money, particularly since this audience is young investigators, and any research grant you get is great when you're young. And so, any questions at this point?
So, regarding indirect costs, actually, we know what's our indirect cost for NIH, but is it the same thing for DoD?
Generally, yes.
Same thing, all the federal grants are the same indirect costs?
Yeah, well, I know, for instance, the University of Delaware, our indirect cost contracts are not negotiated with the NIH. I think they're negotiated with the Department of the Navy, or it's some Department of Defense entity is who is responsible for negotiating the University of Delaware indirect cost contracts. And I believe they're blanket for the entire institution. Well, they're blanket for all the institution except for the Department of or the College of Agriculture. They have a separate indirect cost rate because of all the land in their farm. From the standpoint of foundation grants, there are some foundations that will pay 5 or 10% of indirect costs. Basically just have to go with their foundation policy. Almost no foundations will pay NIH or pay federal indirect cost rates. Companies, those are always open to negotiation. I believe at the University of Delaware, the expectation is that corporate contracts pay the federal indirect cost rates, but I know that that's also a point of possible negotiation. Any other questions? The tricky bit, though, about foundation grants can often be identifying what are the appropriate places to apply for them. Grants.gov is this very nice comprehensive database of federal funding opportunities, but it's squirrelier to find foundation opportunities. Now, I have some links here of places that you could start looking. The first one is called Newton's List. Newton's List is a searchable database for funding opportunities. It tends to have a very international focus. A lot of their grants are based on global public health issues, but there's also a lot of collaborative healthcare issues there. And you can search specifically for grants where the investigators can come from the United States. Like I was just looking through it yesterday. There are some of the grants like might only be for partnerships between Great Britain and Australia. So you have to kind of parse which grants are eligible for which organization. The second one is the geneticalliance.org. The Genetic Alliance is a advocacy organization that is an umbrella organization for organizations interested in rare disease research and rare genetic disease research. These were the people who were largely pushing the Genetic Non-Discrimination Act that was passed several years ago. That was their keystone piece of legislation. They do a lot of advocacy. They do a lot of congressional lobbying. However, they also have a search engine where you can search for rare genetic diseases, and they will link you up to the patient advocacy organizations they're aware of. Now, patient advocacy organizations are kind of an interesting play in the foundation research funding arena. The first one is that if you work on some kind of a rare disease, I would really, really encourage you to become involved in patient advocacy groups associated with it. That these are people who basically feel very marginalized. Many of us work on genes or proteins that, when mutated, cause rare diseases, or that we work on rare conditions. The patient advocacy organizations, even if they're not currently doing grant making, that it does give you a very different perspective on what the patients are going through. They're often more than willing to tell you about symptoms or phenotypes in the condition that might not be all that apparent from reading literature, or just things that they're wondering, well, I have this and this, are they related? And it can help you find connections with your research. However, and many of these also do some grant making in relationship to either helping the patients in their day-to-day life, or they're interested in treatments for the diseases. And one thing that I will say that firsthand, getting involved in patient advocacy groups can result in funding. One of the diseases that I study is called aniridia, and it's a rare genetic disease. There's 50,000 people in the United States. I first got associated with their patient advocacy group about 15 years ago. And I was on their scientific board, but they didn't have much money. They were a shoestring operation. Well, a few years later, a very wealthy woman with this condition died and left her entire estate to this organization. So suddenly they became involved in granting. They also became involved in putting together a lot of tissue banks and this sort of thing. And that I will tell you that the people who were funded first were the scientists who were involved in that organization from the beginning. That currently my research is supported by this group, and there's a lady who actually does fundraisers specifically to fund my research. And it's not enormous amounts of money, but a $30,000 a year grant is real money. Now, you have to do things for this money that are different than you would, and sometimes they're as much or more work than a very large federal grant can be. For instance, I have on my list of things that I have to do to keep my foundation happy. I need to write an entire a guide for people with this subcondition of the disease I'm studying. So, and that's going to be a lot of work later this summer. I have to get it into them by September. But from their perspective, they're putting in a huge amount of effort for the fundraising for that $30,000. So you have to kind of decide, what is this worth it to you? But it also can be very, very fulfilling to be talking to the patients who have exactly what you're studying. And I know in my case, they sent me in a research path, which is now showing promise in being related to a very mainstream disease that I also study. And so this gave me the seed money to go for an NIH grant that's going to be applicable to a mainstream disease. So, really, really think about this in relationship to patient advocacy, because I think it can be a very important point of view. I also, though, know a number of scientists that are like, talking to these non-technical people is a waste of my time. I don't want to go there. If you're successful getting money through traditional sources, that's certainly your opinion, but I actually really do value, working with the patients. I have gotten the play-by-play of every third surgery that the director of the organization has had, but I think it's still very valuable to know the progression of the disease first. So, think patient advocacy organization. Now, the more comprehensive sources, that the one that is sort of what I can tell is the gold standard nationally is called Community of Science. It's also called Pivot. Now, if you are a University of Delaware investigator, the University of Delaware has bought a site license for this. You have free access to the complete in-depth database. It's got thousands and thousands of foundations that can be searched by due date. They can be searched by area. They can be searched by by level of training and so forth. Now, it turns out that Christiana and Nemours investigators do not have access to this database. However, at least for the short term, for those of you who are in our network, that Erin Regal is working on getting access, at least one access in the main office here, and she can work with you for allowing you to do a search through this database. Rob Akins is trying to work on broadening the access to that database to the entire ACCEL group, but at least being able to sit down with a very comprehensive database at one time in your early career can be very, very valuable to you. I've also mentioned Grants.gov, which has all federal grant opportunities. Another place to look is your professional societies. And the professional society I'm the most involved in is the Association for Research in Vision and Ophthalmology. They have an online funding guide with 300 grant opportunities in it. And from what I can tell, this is absolutely comprehensive funding guide for all ophthalmology research. There's some general things in there too. Anybody's welcome to log into that and look at it. It's not just ophthalmology, but it's things where an ophthalmology person could get funded through that mechanism. I know that there are other foundations and organizations that also have funding guides on their websites. Now, if you are a Nemours investigator, I don't have access to this one. But if you're a Nemours investigator, your research office maintains an internal list of potential non-NIH funding sources, including foundations. And this is the TeamShare research funding page. I believe this is the link to it. Also, I believe if you're a Nemours investigator, you get an internal research funding newsletter. Now, from what I can tell, the Nemours internal research funding newsletter, it only is going to give you pediatric grant resources. So that's one reason to really try to broaden your search, especially if you're working on a number of different disease processes. If you're at Nemours and you need access to this or have any problems, Gregory Stetz in your research office is more than happy to get more people to use this as a resource. That it's hard to directly address, since there's so many of these mechanisms and they're very specific for different areas, it's difficult to address, detailed questions in relationship to them. But especially for this group, a very large percentage of foundation money is in fact targeted to young investigators, people making that transition from postdoc to independent faculty member, or the transition from fellowship training to being a clinical researcher. So now's the time when you want to be aggressively searching for this funding because you have the best access to it. Okay, so any questions about my part of this? Because if not, I will pass you on to Claudine Jurkovitz, who's going to talk about PCORI, which I now realize I misspelled. That shows you how little I know about PCORI. And I'll pop her up here. Over here. If you sit here, you're actually on camera.
So good afternoon. Thank you very much, Melinda. And I think I learned a lot, actually. I had no idea that the DoD had such an emphasis on the patient-engaged research. That's kind of the same thing as PCORI. So I think most of you know that PCORI stands for Patient-Centered Outcomes Research Institute. And they have a very comprehensive website, which I really encourage all of you to go to. And everything is well explained there. In fact, most of the information I have on my slides come from this website. So I'll just go briefly through an introduction, and then we talk about some of the mechanisms that PCORI has. So investigators initiated grants, and I'll give you some examples of the grants that have been funded. Targeted announcements, Eugene Washington Awards, Pipelines Awards, and a few words on PCORNet. And I just want to mention that I was asked to give this information about PCORI because I applied twice to PCORI. Once that was not funded, and once that was funded, just got funded actually. And that was a Eugene Washington Award. So I understand some of the tricks of applying to PCORI, and I'd be happy to answer any questions. And please feel free to interrupt me if you have any questions as we go. So definition of PCORI, and PCORI is a new agency. It started in 2012. It's an independent nonprofit. It's non-governmental. So, for example, the indirect rates of PCORI are different from the indirect rates of NIH and NSF. It was authorized by Congress in 2010, and it is funded by the Affordable Care Act. The mandate of PCORI is to improve the quality and relevance of evidence available to help patients, caregivers, clinicians, employers, insurers, and policymakers, what PCORI call stakeholders. And you'll see all over the PCORI website and any announcement from PCORI, the word of stakeholders. And so it's to improve quality and relevance to make informed health decisions. And so PCORI funds comparative clinical effectiveness research, or CER, and you'll see also all around CER. But be really careful, because PCORI does not fund cost effectiveness research, and it is written in the law. PCORI does not fund cost effectiveness. They can fund studies of cost to patients, for example, but not cost effective research. And they support work that will improve the methods. They have also big methodology aspect to PCORI used to conduct comparative effectiveness research. So the goal of PCORI is to determine which of the many healthcare options available to patients work best in specific circumstances. And they do so by conducting patient-centered outcomes research, or PCOR. And PICOR address the questions and concerns most relevant to patients. And you will see this all over also. And again, involve patients, caregivers, clinicians, and other healthcare stakeholders, along with researchers throughout the process. So really the important thing for PICOR is that determine what are the outcomes, the research questions that are most relevant to patients, and involve all the stakeholders. PICOR mission is to help people make informed healthcare decisions, to improve healthcare delivery and outcomes by producing and promoting high integrity and evidence-based information. And this is really important because it's not only engaging patients and stakeholders, but also they want to have a very high scientific, high quality scientific research projects. And in fact, there is a list of standards that they published. It's on the website for everything related to comparative effectiveness research. So from the how to define a research question to talk about heterogeneity in clinical trials, to power calculation, to engaging patients. And there are maybe 20 or 25 standards. And when you write a proposal, you need to mention these standards. You need to refer to the standards, standards number 1, standards number 2, etc. It's really very specific. So the conditions studied, the conditions that are preferred by PICOR are conditions that affect large numbers of people across a range of populations, conditions that place a heavy burden on individuals, families, specific populations, and society. And also, they found a comparative effectiveness for rare disease that are difficult to study because of the small n in these patients. And there are also standards that you need to follow if you want to get funding for rare disease studies. Again, you have to have patient engagement as well as really good scientific research program. And they have some guidelines about rare disease. Populations of interest, racial and ethnic minorities, older adults, low income, residents of rural areas, women and children, individuals with special healthcare needs, and including individuals with disabilities, patients with low health literacy and limited English proficiency, and also LGBT persons. And that's also very important because when you write your proposal, you need really to emphasize which group you are targeting with your research. And they will fund more easily if you can demonstrate that you adhere to the populations of interest that are highlighted in their program. And also veterans. So a few examples of first, there are several categories of investigators-initiated grants. There are 5 categories, actually. The first category is assessment of prevention, diagnosis, and treatment option. And I'll give you some examples in the next slides of these grants. And these are basically clinical trials, but again, with patient engagement. Addressing disparities is another category. Improving healthcare systems, communication and dissemination research, and improving methods for conducting PICOR. And that's really the only one that is based only on methodology. They want you to, that's for people who want to do methodology research, statisticians and epidemiologists. And then there is a 6th category that was started not very long ago, maybe a couple of years ago, regarding pragmatic clinical studies to evaluate patients' outcomes. And most of you know that pragmatic clinical trials are large trials. Most of the time they involve thousands of patients that are supposed to be conducted in normal environment and in real life environment. That's the word I was looking for. And it's with few inclusion and exclusion criteria, and they differ from trials of efficacy, for example. And PCORI is very big on funding these large pragmatic studies. But you need to have, you need to be pretty advanced in your research career to be able to do that, because it's really a network of investigators who can enroll, large number of patients. So here are some examples of the first category. These grants are funded for $2 million in direct cost. So they are really large grants. So for example, the first one, it's a comparison of high intense versus every week therapy in children with cerebral palsy. There is a grant related to improving care for veterans with PTSD. And there is a grant about breast cancer, uncomplicated pediatric appendicitis. That's a multi-institutional trial of non-operative management, and that's probably a pragmatic trial, and another pediatric grant for neonatal seizures. So it's really all over, and again, these investigators who get funded have patient engagement in their proposal, demonstrate that they already have put together a group of patients who can work with them all along the research project. And they also have very good scientific project. Addressing disparities. So again, for example, the first one is reaching underserved patients with Down syndrome. There is another one for unwanted pregnancies among Hispanic adolescents. Another one about interpreters, so for people who have low English literacy. Improving healthcare system. So there are two levels of funding. Small one is 1.5 million, and the large one is $5 million. That's the one we applied a couple of years ago, and we didn't get it. So again, many examples of how to improve care system. And what is really important is that you show that it's going to change the healthcare system, and that you have a conceptual model that is integrated in your healthcare system. And that's what killed us, actually. That all over in our grant, when we submitted, there was a reviewer who said, I don't understand your conceptual model. I don't understand how you are going to integrate this into your health system. And he was right. So, I mean, that was a very good lesson for us. Communication and dissemination research. So, for example, there was a project to reduce antibiotic misuse, another project about joint replacement therapy, looking at decision support, and another one, navigating high-risk surgery, empowering older adults to ask questions. And then improving methods for cognitive PCORs. These are smaller projects because they are really methodology projects, $750,000. And I'd like to attract your attention to the last one, which is in fact from Delaware, and it's from HealthScore. And HealthScore is a company that handles all a lot of data from private insurance, and their project is a model for improving patient engagement and data integration, PCORnet patient-powered research networks and payer stakeholders. And I'll talk about PCORnet later, but I think this is really interesting, and I'll probably try to contact this person, the PI of this project. And some examples of pragmatic clinical studies that have been funded. Another comparative effectiveness of breast cancer screening and diagnostic. Migraine also has been funded. A study of COPD. And what is really important, that what is funded in PCORI is that they want to have comparison of two treatments. If they don't want a comparison of a new treatment and standard of care, or new treatment in placebo, you will not get the grant if you do that. What they want to see is comparison of two treatments who have shown, the two treatments have shown that they are efficacious. But what they want us to demonstrate is that there is effectiveness in these two treatments. So they will not fund, and they say it very clearly, they will not fund trials for efficacy. They only fund trials where you can show effectiveness, to demonstrate effectiveness. And you need to show in your application that the two treatments you are comparing or the two methods you are comparing are efficacious already, and that it is known. A few targeted announcements. So more and more, in fact, PCORI does RFPs for very specific projects that they want to fund. So, for example, there was one in February for clinical strategies for managing and reducing long-term opioid use. That was $10 million, large amount of money for pragmatic clinical trials. There is one in August that will that is to compare surgical and non-surgical options for management of non-specific chronic low back pain for $15 million. Again, large pragmatic trials. And strategies to prevent unsafe opioid prescribing in primary care, and the deadline is in December. And all these subjects, in fact, are decided with patients and with patients advocates and with advocacy groups in advance, and then they are voted by the board and they decide to send this, what they call PFA, PCORI funded announcement. So another mechanism, the Eugene Washington Engagement Award. These grants are not research grants. They are projects, and they provide a platform to increase engagement in research of healthcare stakeholders. And when these grants are, the goals is to produce tools and resources that may be useful to other awardees, with the goal of engaging in research and healthcare and stakeholders throughout the research process. So there are also several categories of Eugene Washington Engagement Awards. So these are smaller awards that are easier to get, actually. Knowledge awards, and I'll go through them a little more. Training and Development Awards, $250,000. Dissemination Awards, and then Engagement Award Initiative Notice. And these fund meetings and conference support for $50,000 if you want to organize one meeting, or $250,000 if you want to organize at least 2 meetings over 2 years. So that's a grant. That's a grant I got, actually. The meeting and conference support for the 2 years project. So the Knowledge Awards, their goal is to understand how patients and other stakeholders access healthcare information to make decisions, and also to determine what research findings would be most valuable. So these are, again, are not research awards. It's just for you to bring a group of patients together and try to understand what is important for patients. And most of the time, this is done by focus groups or several meetings.
How could that be done for rare diseases?
I think so. Oh, absolutely. Absolutely. Training and Development Award, and I think it would be also encouraged. So Training and Development Awards are capacity building projects, and they are intended for projects that will equip teams with the skills necessary to participate in PCOR CER, and also to seek to develop meaningful patient and other stakeholders relationship. And what is important, I think, here to emphasize is that it's really to build the team, not so much to train people in what is in the science of comparative effectiveness research. Is really to build the team and train the team to work together. And dissemination awards, to develop, demonstrate, and evaluate the processes necessary to incorporate research results from studies into decision-making settings. And innovative approaches also to disseminate findings. And so this is another mechanism, pipeline to proposal award, and I think it's really interesting. It's easier to get, and it's really a good way, in fact, to build a program towards this big, large grant I just talked, the PCORI funding announcement, this $15 million grant. So you start to apply first to a Tier 1 award, and that provides seed money to individuals and groups who have healthcare research ideas. So basically, someone, and that may not be a researcher, that could be someone for the community also. Someone has a research idea and wants to develop this research idea, and with people, find people. It's really to build a team. I think it sounds really great to me, and it's up to 9 months term. And then if you are successful in your Tier 1 award, then you can apply to Tier 2 awards that are a little more, where there is a little more funding, 25,000 up to 12 months. And here it's to develop research capacity, create new partnership, and more, even more building of the infrastructure that you really need to conduct your research. And then the Tier 3 is up to $50,000, and here that's what will allow you to build your research proposal. To basically write your research proposal with your community partners and with your patient partners. And in fact, I thought Tier 3, you could only apply to Tier 3 if you had already Tier 1 and Tier 2, but they just published a PFA only for Tier 3 for people who already have their community engaged, their partners, so people who have already set up all their mechanisms. And it's only, and they are ready to write a grant. And that really leads you to write, this big, large, very large research grant.
Actually, in your opinion, I was talking about the patient advocacy group. I mean, would this be a place where being very, very involved in patient advocacy, that would actually be preliminary data for this,
Absolutely.
Right?
I think it would work really well.
I'm interpreting that correctly?
Yes. But I think you need to show that you've done project together already, in order to apply for the Tier 3. And in any case, I mean, for all these these big research projects, the comparative effectiveness research project, massive, several $1 million, you need to show that you have your team already. One of your aim cannot be we build a team. You have to have your team of patients, your team of stakeholders. You have to show that you work together, and then you can apply and write your specific aims. And then just a few words about PICORNet. It's a National Patient-Centered Clinical Research Network. It's a large, highly representative national network for conducting comparative effectiveness research. And it's a resource of clinical data which is gathered in a variety of healthcare settings. And data are collected and stored in standardized interoperable formats. And there is also a large emphasis on data sharing across the network. So these are institutions that produce data to this large database, this large network. And very importantly, all the data that are collected from electronic health records basically are stored in standardized and interoperable formats, and then these data are available for researchers who are participating in this network. This is stop here, and so a few more things I wanted to emphasize to have a successful PICORI applications. Really, I mean, patient engagement is extremely important. And in the PICORI reviewers, I mean, there are always patients as reviewers of the grants. So patient engagement is very important, and you need to demonstrate that you have patient engagement. What is really important also for a research application is to demonstrate that your research question is answering a gap. You have to demonstrate that you have done literature research, and it's really extremely important, and there is a big paragraph, to write a big paragraph on how you are going to fill a gap in this project, in this topic. The standards, the PCORI standards for research, I mean, you need to refer to them all the time, and they want you to show that you know what the PCORI standards are. And in fact, I attended webinars. Some of the board meetings, the PCORI board meetings are you can attend them by webinars. They are available, and there are some projects. Although there was funding, there were some projects that they didn't fund or they didn't spend all the money that they had available to fund projects because they found this project not at a high standard. The scientific standard was not good enough. So I think it's really very important to have patient engagement and very strong scientific research plan. I think that's all I had. Wanted to emphasize.
It's almost perfect. I think it's 1 o'clock.
Oh, is it? Yeah. Oh. Any questions? And for all the new investigators and new investigators, I think this tier funding is a great mechanism. Great mechanism. If you are interested in PCORI.
So if there's no questions, we'll log out. I think there's both. I know everybody here has my email address, and I put Dr. Jurkovitz's email address in my presentation. So if there's questions that come up, I think we'd both be happy to entertain them. If you just want to ask us questions by email offline, that would be fine.
Sure, absolutely.
Thank you very much.
Great, thank you.